Today I wanted to talk to you about how do we decide where to place your breast implants in your body. Do they go in front of the muscle or behind the muscle? This is a question that comes up a lot, and sometimes patients have a very strong view on this themselves, but I think it comes back to a number of issues. We need to have a look at you as a person and look at your goals and what it is that you're trying to achieve, what sort of look that you want to have. That's really important. And then we need to see what is the anatomy that we're going to be putting the implants in. How much tissue coverage do you have in your chest? If you're someone who is really slim, you have a BMI 20 or less, you're not going to have a lot of coverage. So we need to find as much camouflage as we can in those situations to hide the implant. Last thing we want is to have a very obvious implant sticking out, similar to you may remember the implants in Posh Spice in the early 2000s. That's not a result that we want to achieve. It's too obvious, nobody likes it. We want to create a more natural outline of the breast and the implant well hidden within the tissues, and for that we need camouflage. So that's really, really important. Obviously, the other part is dimensions. We take measurements and we decide what size implant we can place in the existing pocket. If you want to go beyond the anatomical limitations of what you have currently, then we need to see if we can borrow tissue from surrounding anatomical sites, and that sometimes is possible, sometimes less so. In this situation, you need to think about what it is I'm giving up by trying to increase the size of the implant. Am I shortening my waistline, for instance? Am I making myself look frumpy as a result? That's actually really important as well. So you do need to consider the holistic picture, not just the implant and the chest breast area where it's going into.